Good morning and welcome to Health Talk here on AM 1270 and 96.5 FM KXBX. Paul Thomas in the studio with Bill Kearney of Northlake Medical Pharmacies. And Bill, you're bringing that sultry voice to the show today.
I've got my sexy voice today. You know, I've been bucking this thing for a long time, and I thought this show we're recording for while I'm gone, and I kept thinking I'm going to get better and better, and then Easter came, and I had about 15, 16 people at Easter, and then as weeks go on, you just think you're going to get better. One of my employees I was talking to him today, and I said, gee, you've been battling this for longer than I have. And I said, you went to the doctor twice. And he said, and I got a prescription. I said, have you taken it? And he said, no, I forgot I had it. I said, well, I'm better than you are, and I haven't taken anything. So I'm drinking hot water and trying to do everything, and it's pretty hard to go to work and not talk. So anyway, we promised you that we would be talking about heart disease, and it has become so significant in this country, even with the knowledge of what we're going through. And of course, diabetes and obesity have something to do with that, but roughly 790,000 Americans suffer a heart attack, and 1 in 7 deaths continue to be caused by heart disease. So it's our nation's leading killer. And, you know, we think about maybe this isn't stoppable. Your blood pressure is too high, your cholesterol keeps raising, your arteries are narrowing, and before you know it, there are procedures that need to be scheduled in order to help you with that. Well, Consumer Reports, many of you may get, but aim to provide customers with a lot of evidence that says there are a lot of possible choices that you can make that really makes it possible to treat heart disease. And then we have this issue, and I hesitated in a way before I brought all this in because there's a lot of statistics here, and we have told you so many times, this is what your blood pressure should be, this is what your statin level should be, this is what your sugar level should be, and roughly it ends up being turned around some way, and it's very difficult for someone to really judge what they really should be. And since we have a large group of healthcare practitioners, either nurse practitioners or physicians that are taking care of our patient load, they all have different ways of controlling that. And as we've talked about in past times, the ability for them to roughly follow you each time you come in the office, because many of them are in a clinic and you may not see the same physician or the same healthcare practitioner. So when you should you start taking statins to lower your cholesterol, or what's a heart healthy diet? How low should your blood pressure go? What's the best way to get there? Do you need an EKG? Do you need a stress test? Do you need all these invasive procedures being done? All of this is rather overwhelming, but people have a lot more control than they really think they might. And a lot of the studies came from the Cleveland Clinic Foundation, which is a cardiovascular hospital who does a lot of research into high blood pressures and strokes and heart disease. And according to a recent analysis of the New England Journal of Medicine, you know, a healthy heart style, and I know you're going to not like what I'm going to tell you because you hear it from me at every program, but that lifestyle, being healthy, can cut the risk of a heart attack or other coronary event like a stroke by 1/3 to 1/2 among people with a family history of this disease. My dad died of a stroke at age 65. My grandparents both died of cancer of the colon, and within 3 months of each other. And of course, I've inherited the high blood pressure and inherited the colon cancer. But what we're talking about is really being informed on everything from the good kind of fats that you can eat, to the very best hospitals, examining all the options. So you don't have to wait till the night before you're going to have a heart transplant to do something about this. And I know that sounds rather drastic, but many times that's what happens. You want to get well, and heart disease starts often quietly. At my age, I think I was 35 years old when I started taking high blood pressure medication. Of course, I was heavier at the time, too. But it often starts quietly and progresses from high blood pressure to clogged arteries within a few obvious symptoms, but then it ends to a big bang, a heart attack. And you need to understand each stand of the heart disease to know what you're going through. We've talked about it being a silent killer, hypertension. And when you do have high blood pressure, you get a lot of symptoms that you can't normally recognize. Your arteries, for example, are very flexible. When you start out at a young age, until you start putting a lot of the bad things in your system, and they may not seem like bad things when you're taking them, the cheese and the fats and the high cholesterol things, but those blood vessels that were very flexible, and when they're flexible, if you get a blood clot or something similar to a blood clot that could cause a heart attack or a stroke, those capillaries and those blood cells that normally flex the blood vessel enough to get through the channel of the artery, they become non-flexible and they become very stiff. And the harder you push the bad diet, the harder those blood vessels get, and they harden with age. A problem that gets worse with too much body weight, not being active enough, smoking, among other things. In those circumstances, blood pressure starts to rise, straining your heart to push the blood through your vessels with an increased heart rate. And you've heard me talk about the analogy of a garden hose. By squeezing that garden hose, you make the diameter of that blood vessel a lot smaller, and the diameter of the hose a lot smaller, and you have to turn the water faucet up to put more pressure through it to get the water through. Well, the same thing happens with your heart. As the diameter of that blood vessel becomes smaller, your heart has to pump either faster or harder, and most times both, to get those blood vessels opened up and get the oxygen through to your brain and other parts of your body. So over time, that damages the vessel walls and creates perfect places for the cholesterol in your blood to lodge in those side walls of those arteries. Arteriosclerosis, which you've heard us talk about before, is a mix of high cholesterol and high blood pressure and other risk factors that can cause cholesterol to build up in the plaque deposits. So constraining the blood flow to the heart, that's called hardening of the arteries. And when those artery walls start hardening, they don't become as flexible, and then the heart has to work harder. For some people, a narrowing of the coronary arteries, the arteries that go into the heart, causes chest pain when they exert themselves, and that pain is known as an angina. And you will hear people say, I have pain in my chest, or I feel pressure in my chest. And when you look at those arteries, coronary arteries that are going into the heart, many of them are smaller than some going through the rest of your system, and they become clogged, just like they do in your kidneys, your liver. But when they become clogged in your heart or going into your heart, and that pain you feel is your heart trying to pump the blood through those vessels, and it can't go through the vessels as hard as the heart is pumping it. So that blood starts to back up in those vessels around your heart, and you get pain from those arteries filling up and not being able to fill your heart up. People with angina are almost lucky in the sense that angina is a pain that signals something is wrong before you have a heart attack. Many people don't have that warning, but most patients don't have. And heart attacks usually happen when a plaque or that piece of cholesterol, that piece of fat ruptures, causing a blood clot to form and block an artery that's feeding the heart. When it blocks the brain, the blood to the brain, you get a stroke. So you have it blocking the heart, which is a heart attack, and then if it goes into your brain, it's a stroke. And sometimes it can be a hemolytic stroke, which is one that causes the blood to get out of your system, and you have a bleeding out instead of a blockage. But either way, the heart's not getting the blood. Aortic valve disease is aging combined with high blood pressure, diabetes. Other risk factors can also damage the heart valves or the flaps. You've heard of people that have leakage into their heart. They have a flap that covers that chamber of the heart, and sometimes that becomes loose and it starts leaking blood. And in that case, then they have to synchronize blood flow through that organ. That can prevent a valve from fully opening or closing, limiting the flow of blood out of the heart or allowing blood to leak back in. So over time, that also can cause chest pain or tightness or shortness of breath. The shortness of breath is because you're not getting any oxygenated cells, meaning those red blood cells that go all throughout your body carry oxygen. And if they are not getting oxygenated, then you're going to feel that tightness and feel like you can't breathe and shortness of breath and sometimes dizziness or just fatigue. You can also get heart failure, which is high blood pressure, the hardening of the arteries as well, valve disease, and heart attacks alone or combined with diabetes and thyroid. We have people that have hypertension, diabetes, high cholesterol called hyperlipidemia, obesity, thyroid disease. All of these things are going on in many of our people at the same time. All these things can eventually weaken your heart, making it harder to pump the blood through the body, and that's what we call heart failure. It can lead to shortness of breath, fatigue, swelling in the legs, the neck, and the abdomen as well. So you can see all of these things alone or combined can make it very difficult to treat a patient that has not been paying attention throughout their life. Me, at 30 years old, the last thing I would have thought, I had just gotten back from the military. I was 27 years old. I had just gotten married, just started raising a family, and found out that I had heart disease and had to start taking blood pressure medication. That wasn't something that I expected. My father had just passed away about 5 years before that, and I didn't know what to do. And as we start getting into this, we find out that there's a difference in the hearts of men and women. It's the number one killer of men and women in the United States and continues to be the most obvious expression of the disease, a heart attack. And it tends to strike women and men differently. For one thing, the attacks on females or women occur later in life. On the average, women have their first heart attack at age 72, compared at 65 for men. Heart attacks are a lot deadlier in women. 26% of women 45 and older die in a year after their first heart attack. That's over 25%, over a quarter of the people are dead at that early age after their first heart attack, compared with 19% of men. Then to make matters worse, the symptoms are usually different, less obvious, and that's why it's so important that everyone be aware of the differences. and how the symptoms differ. Women have a lot more subtle signs, and so you don't think about it as much, such as a jaw or back pain or nausea, a shortness of breath, rather than the classic symptoms of feeling of pain or squeezing in the chest or pain radiating from both arms. And with those kind of differences, a male is more apt to seek medical help to try to do better. So, and then here, the kind of care difference when a heart attack is suspected, and one of the first tests your doctor might want to perform is an angiogram. And this checks for blocked or narrowed arteries, but that may miss a type of heart disease more common in women called coronary vascular microvascular disease, which damages the smaller arteries, not the great big ones in the heart. And lots of times when those larger or smaller microvessels are involved, you can't see the clot as well. It tends to spread more evenly through a female's arteries, making it harder to see in a standard angiogram. And we also have tests of ruptured blood vessels that are above that artery wall. So when you put the camera in, like you do for an angiogram, and you look through the blood vessel, and you're hoping to find a blockage or some sort of a reduced, excuse me, a reduced diameter of that blood vessel, you can actually miss the fact that there is a rupture above that blood vessel. So in many cases, the doctor should consider performing an ultrasound to look inside the arteries in more detail. Anyone who's had a heart attack should be prescribed medications to protect the heart, such as a low-dose aspirin or blood pressure and cholesterol-lowering drugs, and be referred to an exercise and a cardiac program. But women are less likely than men to get referred to those programs or to go when they're referred. Remember, from as long as I can remember, the woman has been the stay-at-home mom, and unless you grew up on a farm like I did, and my mother worked on the farm as well as worked in a factory. And you just don't think about women being in the workplace like men were and having the same kind of stress. Well, if you can imagine living in my house with three kids and two parents, and living on a farm and getting up at 4:30 in the morning, and then my mother getting everybody fed, everybody washed, everybody off to school, and then her off to work, and then coming home and having to help with the chores and doing the same thing, getting everybody ready to help with the chores, doing all the separating, taking care of the milk, taking care of the eggs, coming in, feeding a family of five with substantial meals to get them through until morning. If you don't think that was stress, well, now we have more and more couples, husbands and wives, that are in jeopardy of having that same kind of stress. So they want to test you a lot when you go in. And while the fancier tests can be life-saving if you're experiencing chest pains or a high risk of heart disease, then people without symptoms, it's often looking for trouble. So unnecessary testing is not just a waste of time and money, but can also cause harm. So you want to know, you want to get healthy, you want to get better, and you want to know if you have symptoms, what do I do to find out if I have heart disease? Well, there are things that you can do at home. And one is taking your own blood pressure. And taking your own blood pressure in an environment that's not stressful. Now, that's not at a daycare center, or that's not while you're milking 35 head of cows. That's when you're in your house alone with your spouse or significant other and taking your blood pressure in a non-stress environment. Electrocardiograms are another thing that you can take, where a physician may ask you to have these attached to your chest so they can find out a lot more about what's going on, especially if you have heart disease such as chest pain, and if you're at risk of heart disease when starting to exercise. So the EKGs, along with a stress test, which measures your heart function while it's stressed by exercise or medication, may be useful when combined with an EKG. And if you remember me talking a couple of weeks ago about taking medication when you're taking a stress test, one of the things that they try to take away from you so you'll have a more accurate stress test is a beta blocker. We're talking about drugs like altenolol, metoprolol, propanolol, Corguard, those kind of drugs that have a tendency to be a tranquilizer for the heart. And they're rather inexpensive drugs, ones that we put people on along with diuretics or drugs that take fluid out of the system to individuals that may be at risk. So when you are taking a beta blocker and you're taking a stress test, it's hard to get your heart rate up to a point to see when it becomes dangerous. And because the medication takes the stress off the heart when you intervene with stress, and makes it very difficult for them to get a reading. So many times they will take the medication, especially if it's a beta blocker, away from you while you're doing the stress test. Sometimes they do an abdominal aortic aneurysm test, and that's an ultrasound to look for a ballooning in the main artery, which can be deadly if it bursts. 95% of the people that have an aortic aneurysm and it breaks, or even with the surgery, don't make it. It may be useful for people with detectable lumps in the abdomen and men who are 65 to 75, especially those people who have smoked, and women 65 and older who ever smoked might consider it, though evidence for them is less certain. And there's also a peripheral artery disease test where there's a comparison of the blood pressure in your arms with the pressure in your legs. And many of you may have had that and not exactly know why, but it may be useful for people with cramping in their hips, thighs, or calves when walking or exercising. And then they can also do an ultrasound of your arteries, and sometimes they will put a chemical in the testing mechanism to look for narrowing of your arteries. It may be useful for some people who have had a stroke or a mini stroke that we call a TIA. And angiography that produces a 3D match image of those arteries may be useful for people with chest pain and unclear results. So we have a multiple group of tests that we can do, and many times we can slow down the possibility of having to have excuse me, an angiogram or some kind of a test that is more intervention than what we want to do. Sometimes heart disease erupts as a full-blown emergency with sudden crushing chest pains, and that's when immediate intervention to restore the blood flow to the heart can be life-saving. But in many instances, the path to aggressive care moves faster than called for, which can lead to overtreatment as well. I'm not calling anybody out here, but I've been in the medical system for many, many years, And there are lots of options before you have bypass surgery or before you have a heart transplant. When it's not emergency, you slow down and do more research. That involves talking with your doctors about everything from whether you really need an expensive imaging or an invasive procedure to which hospital to choose. Paul, I think you yourself in the past were in a situation where there were going to be some tests that were going to be on your heart. I think you eventually got them covered, but because you asked questions, otherwise it was going to be quite costly to you.
It was, yeah.
And that's options that many of us don't ask those questions. And I don't think we can any longer assure ourselves whether it was Obamacare or any kind of a new insurance program, no matter who you are or what you have, that these insurances are going to cover you. In your case, Paul, I think in some of the instances you had to go to a physician that was not here at the time. I think that was maybe your sleep apnea test. Or
well, let's see. Actually, the sleep apnea test was here in Lakeport, but it took like 6 months to get in.
Right.
I mean, it took forever to get in. And then I had to go see a specialist in Ukiah for when I had to go see about like a colon test. So
then you had a stress test.
And then I had a stress test. That was here at the hospital.
Yeah. And you know, we don't think about. We think about having major medical insurance. We think about these things being covered, and they aren't always covered. In Paul's case, he came out of them all okay.
I hope.
I hope. You know, in the sleep apnea test, we found out that you did, and it was a lifesaver for you.
Sure it was, yeah.
So, and that may or may not affect your heart. I just had a friend a couple of years ago, in fact, a year ago, Super Bowl, that had been at our house, that was in his 60s, and he had sleep apnea, and he had gone to sleep. Been a great day. He'd worked outside a lot. Had gone to sleep, and his breathing stopped. His wife woke him up, and he started breathing again. She was reading beside him and started to stop breathing, and she woke him up again. The third time, she couldn't wake him, and it was he had a heart attack because of his sleep apnea.
Did he use like the CPAP machine at all? Or?
He had it,
but he wasn't using it.
But he wasn't using it, and we have a lot of people like that.
Yeah,
because it's uncomfortable.
It is. I'm guilty of. I mean, I use it. I can't say I've used it every day, and I can't say I use it all night. But I try to put it on at night, and sometimes I wake up after a couple hours and I have to pull it off.
Yeah.
My biggest complaint, other than the discomfort of having a big mask on your face, which I've gotten kind of used to, is how dry it makes my mouth because of the constant pressure of air that gets pushed in there. And I wake up in the morning and I feel like I've got a leather mouth, and it's just not.
Don't some of them have moisture?
It does. It has moisture.
Does it?
Yeah. Oh, yeah. It's got a water tank, and I put distilled water in it, and it's got filters, and I change them out and everything. I don't know. Maybe it's a condition that I just have, an pre-existing condition of getting a dry mouth anyway. But I noticed that that there are sometimes that are worse than others. But then there are nights like last night where I was on it for 7.5 hours, which is remarkable, and didn't wake up once the whole time, whereas before when I would sleep I'd be up literally every hour,
Don't they have other kinds of apparatuses also?
They do, and I've gotten to the point now, it's kind of funny because initially they wanted to give me what's called a pillow, which just goes around your nose, but it was determined that I was too much of a mouth breather, and that I didn't sufficiently breathe through my nose. But I've since been able to train myself through using the mask that I breathe through my nose now when I sleep. And so, and that also helps prevent the dryness in the mouth is, on the nights when I seem to be able to breathe better through my nose. I've always had nasal
Yeah.
situations, and you can hear it in how I talk. And I had, my adenoids taken out when I was a kid, and my mom swears I should have had my tonsils taken out, because I've always had difficulty with breathing my whole life.
It seems like whenever your immune system gets down, it settles.
Yeah,
that's where it settles.
That's where it settles, right there in my sinuses. So yeah, I have been intending to call the what is it, Apria, and see if I can get a different mask set up. But and talking about just the frustration of healthcare. Going through them to get anything done is a chore in itself. They've got a location right here in Lakeport, but if I wanted to walk in the door and have something done, they would say, no, get out of here, go call the 800 number and sit on the phone for 45 minutes and then talk to somebody that you can barely understand and, go through 3 or 4 different channels to get to the right department because the number you call is not the right number for what you want. And I've dealt with that a lot with the whole process that I've been going through over the last couple of years with healthcare.
Well, you can imagine how seniors deal with it because they just get frustrated.
Yeah.
We're going to take a break, and when we come back, we're going to talk about are drugs or stents better? You may be surprised. Springtime. The sun shines, the bees buzz, and for millions of Americans, it's time to lock all the windows, blast the air conditioner, and hope that wonderful air filled with pollen never makes its way indoors. Hi, I'm Bill Kearney, pharmacist and owner of Northlake Medical Pharmacy. According to a national survey, 80% of the people interviewed said their allergy symptoms disrupt their lives. There's no reason to let allergies disrupt your life, and there are many preventatives and treatment options. Pollen probably won't kill you, but asthmatics and people with compromised respiratory systems are warned to take precautions when pollen counts are high. So over-the-counter remedies provide adequate relief for many sufferers, and most prescribed antihistamines will provide the same degree of effectiveness. So if you're suffering from seasonal allergies, stop by Northlake Medical Pharmacy and talk to our knowledgeable staff about your allergy symptoms. Find out what medication is right for you. Northlake Medical Pharmacies with 2 locations to serve you, at Hill Road next to Sutter Lakeside Hospital and outside Bruno's Shop Smart at 347 Lakeport Boulevard.
When today's veterans come home, they are thanked and honored for their service, and rightly so. But for the veterans of the Vietnam War, there was no hero's welcome. Far too often they were disrespected, ignored, or simply forgotten. Never again. This is David James Elliott. It was an honor to play Commander Harmon Rabb on TV's JAG. The Education Center at the Wall will preserve and display photos, letters, and memories of Vietnam veterans so their stories and service will never be forgotten. Recently, a dedicated group of Americans put together a generous donation to build this center, and now they're asking for your help. From now until Veterans Day, they will match your donation dollar for dollar in order to complete this mission. Help us build it. Please visit buildthecenter.org. Share your photos, your stories, and help us with this important mission to connect our nation's past with our nation's future.
A message from the Vietnam Veterans Memorial Fund.
I really didn't feel safe anymore at home.
Every year, tens of thousands of youth experience homelessness.
The possibility of sleeping out on a park bench, it's not something that a 15-year-old should have to think about.
1-800-RUNAWAY provides 24-hour access to a nationwide network of housing and support services.
I felt such warmth. I felt comfort. I felt safe.
Call 1-800-RUNAWAY. Go to 1-800-RUNAWAY.org or text 66008. We can end youth homelessness.
Hi, I'm John Cicada. Did you know that chronic hepatitis C affects approximately 1 million Hispanic Americans? I'm visiting my father today, who's part of that statistic. And while not every story is the same, I'd like to tell you his. Such a proud man, old-fashioned, the provider, hard-working man. Stay strong, be silent. But this disease is just as silent. He lived with it for at least 20 years and never mentioned how sick he was getting. Never talked over any of the options with his doctor. If I'd have known more about chronic hepatitis C, I could have encouraged him to take action sooner. Then maybe I'd be visiting him at home instead of here at the cemetery. If you still think there's strength in silence, think again. Please talk to your doctor about your options and learn more at tunein-to-hepc.com.
All right, we're back.
Okay, we were talking about Paul. Now we're going to talk about you.
Good.
About drugs or stents better, and a lot of people don't know what stents are. But lots of times you undergo a stress test and it has an abnormal or uncertain results, and there's a whole cascade of procedures that all of a sudden speeds up. In that lab, they call it a cath lab. The physician first performs angiography, which involves threading a thin tube into an artery and injecting a dye so the narrowing shows up in an x-ray. But sometimes patients are asked to sign a consent form that allows doctors, if they see restricted blood flow, to immediately perform a procedure called angioplasty or to remove the blockage. Now, I'm going to be careful about what I'm saying here because I don't want to go against your cardiologist or your internal medicine doctor, but that's not usually necessary. What happens is you hit the panic button, and having a thoughtful, transparent discussion of all the treatment options, and usually it doesn't allow for that. So performing an angioplasty involves a doctor inflating a thin balloon in the artery to widen it at the blockage where it's stopping the blood flow, and then leaving a stent, which is a little mesh circular piece that fits in there and props the blood vessel open. And it could be life-saving when performed within hours of a heart attack. But other circumstances, lifestyle changes plus drugs to control pressure and cholesterol, prevents clots, is at least as effective and usually safer. In the Journal of American Medical Association Internal Medicine found out that they could cut the number of angioplasties by 80%. Now, one explanation of the continued overuse of angioplasty is that it's seen as a moneymaker for doctors and hospitals. Look, I was on the hospital board of directors, et cetera, for many years. And they didn't have a cardiac unit per se. So I didn't see that sort of thing. I will tell you, when I first came to Lake County in 1980, there were a lot of cardiologists that came to Lake County. And there were a lot of bypass surgeries that went on. It seemed like any time there was a blockage, there became a bypass surgery. I'm not saying, I'm a pharmacist, I'm not a physician. I'm not saying that they weren't necessary. I'm saying there's a lot of procedures that have gone on since, and a lot of medications that have come out since, that maybe lower the opportunity for those considerably. And it often makes sense to try 2 or 3 months of lifestyle changes and drugs first. And then, if that doesn't work, turn into angioplasty and stents if it doesn't erase those symptoms enough. So then we talk about what are we going to do? How are we going to change our lifestyle? You thought a doctor or nurse should check your pressure at least once a year. That's a good argument for doing it at home too. I'm always amazed when I go into a doctor's office that they get the blood pressure cuff over my shirt, over my sweater, put it on, pump the blood pressure up, and then take the reading with the stethoscope. When I use the same blood pressure device to take my blood pressure, the instructions are to have the cuff close to the skin, with both feet on the ground, your hand extended and your arm flat on the desk, equal to the level of your heart. Now, that's how you get the most accurate display of blood pressure. And I'm not saying that the blood pressure the physicians do aren't as good. I had my blood pressure taken the other day with a wrist blood pressure device, and I suggested to the healthcare practitioner, these aren't nearly as accurate as the one that you put on your arm. And the health practitioner said, you're right, but it gives us an idea of whether there's a risk or not. Now, I didn't happen to be in the doctor's office for a cardiac event or treating a cardiac event, and that may in itself, the fact that the health practitioner understood that this wasn't the most accurate form that it was, but you need to have a lot of patience when you're taking your own blood pressure, and if you're taking a home one, those are the instructions you need. These are little microphones that are digitally read that are in your electronic blood pressure kit. So you need to have both feet flat on the ground. You need to be sitting straight up with your arm extended out level with your heart, your palm open, and then keep pumping your blood pressure up until you get to at least 20 or 30 points above where you think you should be, and then let it go down. Now, if you're not up high enough above what you think your blood pressure is, you need to let all the air go out of the device and pump it back up again and go up higher than you were before. Double check your medications. There are things that influence your blood pressure, like over-the-counter decongestants, pain relievers, many non-steroidal anti-inflammatories. Even home supplements can cause pressure to rise. Watch caffeine. Don't take your blood pressure right after you've had a cup of coffee. That can cause a temporary blood pressure rise. So does energy drinks. So do sodas that have caffeine in them. Excuse me. Go to the bathroom. A full bladder can raise your top number or systolic level by 15 points. Never thought of that. But you want to be as normal as you can be when you take it at home. So any of those things that can influence your blood pressure, and sit correctly for 5 minutes, have your back supported, your feet on the floor, your legs uncrossed, your arms supported, and measure it twice. If you get a reading the first time and it doesn't seem right, and I've had many times, we take people's blood pressures, and many times that first blood pressure we take either errors out or is extremely high. We let all the air out of the cuff, even take the cuff off and put it back on again. When you take the blood pressure, it compresses that brachial artery, and that's that artery that goes right through your elbow and up to your bicep, and that needs to re-expand. So let that re-expand for about 5 minutes, put it back on again. Even talking can raise the number by several points, up to 10 points. And if you take it over clothing with too small a cuff, the count can be way off too. So no matter what you do, it ends up, all of those things can have a factor. You don't want to just get done exercising. You don't want to have just got done eating. You want to not have got done drinking caffeine or a stimulant of some kind. All those things can cause your blood pressure to accelerate and, of course, put you at risk. So you need to focus on your overall risk of what's going on. You know, when I'm talking about diet and exercise, how important that is. You need to redesign your palate and make vegetables, fruits, whole grains, nuts, and beans the center of your foods. Think of meat as a condiment, something that you just eat a little bit of, 3 to 4 ounce portions, about the size of a deck of cards. Once you start eating less of those things, and now I think of a size of a deck of cards as a pretty good sized piece of meat. A couple of slices of bacon, it's hard to recommend some of the things that you do like so well. It's hard to not recommend them. Of course, bacon and processed foods are difficult, but you make them an exception rather than the rule, and kind of limit your sweets. I've never had a thing for sweets. Have you, Paul? Have you got you a candy person or?
No, I'm more of a salty guy. I like
am
the
too.
salty stuff, salty and sour.
Probably just as bad.
Oh, I'm sure. Yeah. So I like peanuts and jerky and pickles and those kind of things more than I do chocolates.
Yeah, you can give me a pickled herring or what were the sunflower seeds you used to eat?
Pickle flavored sunflower seeds. Yeah.
You don't do that anymore.
No, I don't. I got off the sunflower kick. Probably not good for me.
It's kind of messy too.
Yeah, it is really messy. Yeah.
But I would much rather have the salt, and that's not good for you either.
No.
If you retain any kind of fluids. At Easter, everybody was having candy rabbits and tweets and those kind of things. I ate the boiled eggs, but those and people think that eggs are bad for you. Many people think they should completely avoid eggs because they're high in cholesterol. But your body produces on its own a lot of good cholesterol, and new research shows that the cholesterol in food has a smaller impact on your overall cholesterol levels than once thought. So for foods that are high in cholesterol but low in saturated fat, such as eggs, lobster, and shrimp, a serving a day is fine. And don't fear all fat. Many fatty foods, avocado, fatty fish like salmon, nuts, seeds, olives, other vegetable orders are often rich in heart-healthy unsaturated fats. You still should try to avoid the foods that I like the best, and those are saturated fats such as meat, cheese, butter. Those foods cause your body to produce more cholesterol, that substance that gets deposited in your artery walls. But with all of that, I don't have a cholesterol problem. I do have a triglyceride problem, but not a cholesterol problem. And I actually switched from eating margarine, and I don't eat much bread, but margarine on an English muffin to using real butter, and it's affected my triglycerides some. But as we go through all of this, you need to focus on your overall risk, though blood pressure and cholesterol levels are important. Your age, your gender, your race, whether you smoke, whether you have diabetes. Everyone over 40 and over should know that their overall risk of having a heart attack or stroke. So there is a way to estimate your 10-year risk by using a calculator developed by the American College of Cardiology. The ideal is a 10-year risk that's less than 7.5%. I always tried to stay below 5. They take your HDL, your LDL, and your total cholesterol and measure that. I haven't done it lately. I probably should do it. And as much as you have listened to me in the past, this shouldn't shock you. But don't rush to drugs. If you're at a 10-year risk that's greater than 10%, or if your LDL, that bad cholesterol, is over 190, you should probably start a statin. And your physician may insist on you starting a statin. But if your risk is between 7.5 and 10, it can be worth trying lifestyle changes first. That means stopping smoking, losing excess weight, being active, consuming a heart-healthy diet, drinking alcohol in moderation only, getting your blood sugar levels under control. If that doesn't lower your risk enough, after 3 to 6 months, consider a statin, even if your LDL cholesterol isn't elevated. Another thing a statin does that we found out many years ago when we started putting everything on statins is it acts as an anti-inflammatory. And that rupture that we talked about briefly the first half of the show, that sticks above your artery wall. When you go through and look for a clot, if you take a statin, and a lot of people take a statin just as a prophylactic to getting hyperlipidemia or high cholesterol, or dying of sudden death, because that's what happens with many times. So a lot of athletes take statins as they're an adult to affect their lifestyle, can slash your risk of heart attack, and in some cases eliminate or reduce your need for the medication. So exercise can lower your systolic pressure by up to 9 points. Every 11 pounds of lost weight can reduce it by 2.5 to 10 points. So getting the right medications when you need them is the right thing to do. Statins are thought to work not only, as we said, by lowering LDL cholesterol, but also stabilizing the plaque deposits in the arteries, making them less likely to rupture and send blood clots throughout the body. So that's all you need to remember about statins. They're going to lower your LDL cholesterol, and they're going to act as a stabilizing factor to keep from having a ruptured blood vessel. Those are 95% of the time fatal. And many of the time these happen to otherwise healthy people. So people who have a history of a heart attack or a stroke, or at a very high risk of one, greater than 20%, should start with higher doses of a potent statin. Now we tell you, if you have had a heart attack or a stroke and you're being discharged from the hospital, you should probably be discharged with an 80 milligrams of atorvastatin or 40 milligrams of Crestor or something similar to that, or other people who need a drug should start with lower doses of lovastatin and maybe 40 milligrams, or pravastatin, or simvastatin. People use different kinds of drugs to lower blood pressure, and for people with levels above 150, it could take, and this your systolic pressure, can take a combination to control it. It always makes sense when you're trying to determine what kind of medication to use, to start low and go slow. And that's what we have found with almost every kind of medication that we use to treat, no matter how serious a disease state it can be. It makes sense to start with the oldest, the safest, and least expensive drug. In the high blood pressure case, it's usually diuretics or water pills, such as chlorothalidone or hydrochlorothiazide. We remember that works by taking fluid from inside the body that's pushing against a blood vessel, a vein, or an artery, of taking that fluid out, because when you take the fluid out, the diameter of that blood vessel expands, and that makes the heart have less work to do to circulate the blood through. So if that doesn't work, you may need to switch to a ACE inhibitor or a calcium channel blocker or another kind of drug. And the reason is we have different drugs as they do different things. And when we go to a beta blocker, it's a drug that affects the way the heart reacts to stress. So, as we talked earlier in the show, it lowers the heart rate. When it lowers the heart rate, the heart isn't having to work so hard to pump the blood through. And if you're also lowering the stress on your heart by taking a beta blocker as a tranquilizer to your heart, that also is relaxing the blood vessels. An ACE inhibitor, like many of you take, lisinopril, Acupril, any of those, open up the blood vessels also, so the heart doesn't have to work so hard to pump the blood through. They do it differently. They inhibit a drug that is causing the blood vessels to restrict under stress. So they stop the action of that receptor and keep the blood vessels open excuse me, so the heart doesn't have to work so hard to
Oh, there you go.
Oh, we're back to get the blood through. So if you're taking the right medications at the right time for the right kind of condition, then you're doing the right thing. And it takes a constant level of educating yourself on what to do, because as times change, we know one thing: diet and exercise always works. Screening tests that you may not need is an option for you, and you need to be proactive when you get into that situation and make sure that you discuss the possibilities with your physician. Now, you know, they're all busy. They're on a time frame. They want to make sure that they do the best that they can for you, but many times it's in the shortest amount of time. We need to slow them down. And I'm not, it's the state of healthcare today. I'm not criticizing any physician. If I was in the same position, I would be doing the same thing. You only have so much time to see a patient, and there's 10 more there to see when you're done with that one. And if there's a complication with the patient that you're seeing and you need to order more tests and get them in to see somebody else, you have to take time to do that. Now, if you're the proactive patient, you may be the person forcing him or her into making a decision like that, where you need to discuss the next step rather than just go into the next step. Remember, you're paying for this health care, and it's something that you need to be sure that you're taking your health into consideration and your pocketbook into consideration, but your health is the most important thing that you need to worry about, and you need to be the person that's proactive. We want to remind you that we're still giving out free vitamins for kids, Good Neighbor Pharmacy vitamins for anybody under the age of 12. Have your parents sign up and bring in your information, and we have a card that we mark off and give you a free bottle of vitamins every 30 days. We continue to do that for you, so don't forget about it. It's easy to not make that a priority, but it costs you nothing to walk in the door and say hello and keep your kids healthy. Also, immunizations for you to do the Zostavax shots and the other shots that we give to keep you up to date with your immunizations. We'd like to remind you we're North Lake Medical Pharmacy with 2 locations for you at 5136 Hill Road East across from Sutter Lakeside Hospital. Call us there at 263-6192. And downtown outside the Bruno's Shop Smart at 347 Lakeport Boulevard. Give us a call there at 263-1328. Thank you for putting up with me, Paul.
Oh, thank you. And we'll see everybody back here again next Tuesday for Wednesday for Health Talk here on AM 1270 at 96.5 FM KXBX Lakeport.